morning, everyone, respected dignitaries, esteemed faculty, distinguished guests, and our participants. My name is Isha Tiwari, and I feel deeply honored to welcome you all to ONCOSURG BHU-2 2026 CRS with High-Tech Masterclass, Life Surgery and CME, hosted by the Department of Surgical Oncology, Institute of Medical Science, BHU. Today's workshop is not just an academic gathering, but a confluence of clinical excellence, surgical precision, and evolving oncological science. This masterclass has been meticulously designed to provide a comprehensive learning experience featuring a live CRS with high-tech case demonstration, a pipette dry lab demonstration, and an engaging afternoon CME session with expert lectures. We are privileged to have with us some most respected experts in the field, and we are certain that today will be an intellectually enriching session for all of us. Before we begin this session, I would like to present our gratitude to our Director Sir, Professor S.L. Sankar Sir, and our Medical Superintendent Sir, Professor K.K. Gupta Sir, for their kind presence. Sir, Director Sir has joined online with us. As we stand on an institution built upon vision, values, and legacy, we now proceed to seek blessings. I request our dignitaries to kindly participate in the garlanding of the bust of Mahamaya Pandit Madan Mohan Malviya, the revered founder of Banaras Hindu University. Thank you, everyone. As a token of our respect and gratitude, we would like to present bouquet to our esteemed guests. I request Ms. Ashwati to present a bouquet to MS Sir. Thank you, sir, for your presence. I request Ms. Ashwati to present a bouquet to Ansari, sir. Sir, we are the home faculty, sir. Thank you so much, sir. I request Ashwati to present a bouquet to Professor H.S. Shukla, sir. Thank you, everyone. To formally commence today's proceedings, it is my privilege to invite Professor Malika Tiwari, Head, Department of Surgical Oncology, to deliver a welcome address.
Thank you, Isha. A very warm welcome to everyone. This is for the first time that we are organizing this high-tech with CRS CME and also a pipette dry demonstration, which is a matter of privilege to us as a department. And there is a small PPT that I would like to share before you, sir. Can we start the presentation, please? So, very warm welcome to our director, sir, also. Sir, I'll just take a few minutes of your time. Please, next slide. So, can you have this full screen, the presentation? So, this is a brief because I thought we will tell everybody what peritoneal surface malignancy includes, and also it's a challenge to treat because nowadays what we know that there are various organs in our body. Peritoneum is also now considered an organ and has to be treated aggressively. The disease is confined to the peritoneum. And the tumors that we actually treat with CRS and high-tech include tumors arising from the peritoneum itself, which is a mesothelioma or ovarian malignancies, and also some appendiceal, colorectal and gastric tumors. Alright, so the reason is that giving chemotherapy and cytoreductive surgery actually enhances survival in certain cancers, which is not feasible only with systemic chemotherapy. Next, please. So essentially, to all those who don't understand the concept, it consists of two parts. One is cytoreductive surgery, where we debulk as much of tumor as possible within the abdominal cavity, and then subject the patient to second stage, which is HIPEC. HIPEC is nothing but there is a perfusion pump that pushes heated chemotherapy into the abdomen, and that is the peritoneal cavity. If you can see the flow diagram there, and then it comes back to the heat exchanger, which is extracorporeal, and hence the fluid circulates with the chemotherapy inside the peritoneal cavity for a specified period of time at a specified temperature, generally between 41 to 43 degrees centigrade. Next, please. So this is the RAN performer system that we have procured with the blessings of our Honorable Director and the Vice Chancellor, sir. And that is how the circuit operates. The speciality of this machine is that it can also be used for giving chemotherapy into the pleural cavity as well as isolated lymph perfusion for advanced sarcomas, which no other machine can offer. Next, please. So this is our proud privilege that we are introducing this program at BHU. BHU holds a very important position because we are a training institute where we are training MCH residents, and we have 5 of them per year. We are aiming to increase it to 7, and besides we also have fellowships in gynec oncology which we are running, and we continuously assist our gynec colleagues in their theatre also. Next, please. So the most important impediment is patient access because of the cost. And we would like to work with the administration so that our institute is enrolled in the Ayushman Bharat Yojana, so that our patients can benefit from it, and also from the PMNCL fund. We still do not have a code in UP for HIPEC to the best of my understanding. They have it in Delhi and Gurgaon, but we don't have it in UP. And this is some of the data that I would like to share on this occasion. As you can see, this is the data spanning from January 2024 to March 2026. About 2.5 years or so, we are seeing approximately 2,500 plus cases in a month. 99% of them are pure oncological cases. Next, please. And if you look at our operation data, these are the major cases that we do. It's about 85 to 100 per month. These are GA cases, and 1/3 of additional cases will be there if we include minor cases also. And if we look at the ovarian cancer burden that we do, it's about 100 plus cases in a year. And that makes about 7 a month. So that's a substantial number. In this, about 50% would be requiring a HIPEC. Next, please. And the other thing that I learned recently at Singapore National Cancer Center is a pipette therapy that we have got a grand demo today. And this is a specialized type of chemotherapy in very advanced cancers in which HIPEC cannot be done. It's a very small pen type of a nebulizer that uses the pressure injector to push the chemotherapy into the abdomen that aerosolizes and causes a slow storm appearance. It's a very short 30-minute procedure, and it has very good palliative effect, and sometimes it downstages the disease so that HIPEC is possible. So it can be replicated in many centers. There are some things that we should know, and that would I be demonstrating today. Next, please. And I'm very happy to tell that we have 2 very international faculties with us today. One is Professor M.D. Ray, who is Professor of Surgical Oncology at IRCH AIMS. He's a distinguished personality with over 15,000 cancer surgeries, 1,000 CRS HIPEC, who has designed about 5 or more oncosurgical techniques and instruments. He has designed one of the retractors which are specifically used for HIPEC. So I got that retractor system also from Bangalore, so that our residents are exposed to that. And we will be enjoying his surgery and his discussions today. And I'm also very happy to invite Professor Rakesh Garg from AIMS. He is also from IRCH Onco Anesthesia and Critical Care. Because anesthesia plays a very important role in this, because the patient is exposed to heated chemotherapy, the core temperature can change it. And there are a large number of fluid shifts that happen. So this is just to have a teamwork effect, and let us just make the best of it. Next, please. Now I request our faculty to please interact with our dignitaries here. Can we have that Cisco link back again? faculty is already there, sir. They will just interact with you. Please give your blessings, Director sir. Thank you. Director sir, the mic on. Director sir, thank you.
Thank you so much, my heartiest congratulations to all the faculty members, Dr. Malika
Just a moment.
and Neville. Really, this is a very wonderful program you planned, and congratulations to machine as well. And it was your perseverance, continuous perseverance for the machine, and you got it. And same time, you also continuously tried for the robot that we are also getting. So, for you people, really, you are wonderful. Malika ji, you are doing in future as well. My best department, and I also welcome our external member, Dr. Ray, and Dr. Vakar, in this workshop. I hope this will be a milestone for future development. My best wishes for success of this grand event. Thank you so much. Thank you.
Thank you, sir. Okay, sir. Thank you for your time.
Hello, Dr. Monica, are you listening?
Yes.
Okay, right. Thank you very much. Okay, right.
Okay, so we have our medical superintendent, sir, Professor
Good morning, sir. Good morning, everybody. Good morning, all the dignitaries here.
Yes.
And definitely, I like to thank Dr. Monica for inviting us. We are doing for a long time the CRS HIPE program in our institute in 2012, and we have performed already more than 1,000 cases there. Only the CRS HIPEC, along with the PIPEC also we are doing this thing. And once again, I will definitely thank you. I know this thing, knowledge is sharing. Only one thing we can share and that increases, that is only the knowledge. So we like to learn from each other. That is our motto. And thanks once again for inviting us. Me and Dr. Rakesh is my right hand. All the complex cases I perform only because of him. He's so expert in that. I am very much happy that that kind of anesthetist with us. And I brought him, so I am very glad to, he is with me only. Thank you once again, sir. Thank you, everybody, and special thanks to, even Dr. Torun is there. He is very good to me, good friend of mine. And thanks to Dr. Murlika for inviting us. Thank you once again. Thank you.
Dr. K, would you like to say something? And then Professor K. Gupta, sir, will say a few words.
Thank you, madam, for inviting us. And as Professor Ray mentioned, that we learn from each other, and I'm happy that BHU is also starting this type of surgery, because a lot of workload and a lot of patients are there across India. Opening many centers will help our patients to provide them the best possible care. I remember a decade back, patients were not getting this treatment. They were moving out of the country. It's a very costly procedure with a lot of morbidity and mortality. But the way we have grown in last couple of years, we have reduced the morbidity and mortality drastically, and the outcomes are really good. And India is always taking a pride and a step forward in healthcare. I'm sure that BHU will take it forward, providing the best possible care to our patient, to our country. And thank you so much, madam, for inviting us. Thank you so much, the whole team or the leadership, MS sir, the director sir, for inviting us and giving this opportunity to share what we have learned for the last couple of years. And I'm sure, and I put my best wishes for a successful program in future also. Thank you so much, madam.
Well, good morning to everybody. All invited in-house dignitaries and Professor Ray and Professor Garg. Thank you so much for enlightening us with your expertise. This goes way that how do I do it and how do we do it? So this is the transition we are going to have today with you, and definitely our institution is going to go ahead with this kind of new therapy, new modality of the therapy, and naturally we will produce more MCH students with this kind of expertise in their hand. Thank you once again. Thank you very much.
Okay, thanks. We will be winding up this session now and go back to live surgery. Thank you, everybody.
Thank you, everyone. With this, we conclude our inaugural session. As we move forward to the most anticipated segment of today's workshop, the live case demonstration post-NAT carcinoma ovary for CRS with high-tech. This session will be conducted with expert coordination between Dr. Tarun Kumar and Dr. Angita from Telemedicine Boardroom and Dr. Neville and Dr. Gautam from Surgical Oncology OT. And we are privileged to have renowned experts, Professor M.D. Ray and Professor Rakesh Garg with us. We now request everyone to kindly direct their attention to the live operative session. While the operation theatre is being prepared, that the live operative session, after the live operative session, we will have a pipette dry lab demonstration by Professor Malika Tiwari ma'am. Thank you so much.